Hey guys, my name is Dr. Amanpreet Singh and I'm the founder of Dental Secrets. I created Dental Secrets as a hub to talk about everything dental related. I already have a lot of videos on my channel that are really catered towards patients. So these videos really answer a lot of the common questions patients have. We talk about things like teeth whitening, bad breath, how your diet plays into your oral health, and what the best foods are for your mouth. And we also go over miscellaneous dental problems and other general health topics. But now in this podcast, I wanted to reach out to those who are actually practicing dentistry and talk about some of the things that we run into every single day. I'm going to go over ways to make your lives more efficient, to go home with less headaches, and to really make your patients happier. Dentistry really is a journey. You could be practicing for 20 years, and I guarantee you the next time you go in your office, you're still going to learn something new. Everybody's mouths are different and every tooth is different. But not only that, you're also interacting with different patients who have different attitudes and different expectations. You're also interacting with your staff, and if you get into ownership, you're making business decisions on top of that. Dentistry is not an easy profession. You're working in a very limited area and you have pretty high expectations. But the good news is it is a fun profession. Whether you want to get into implants or Invisalign or more complex aesthetic cases, you can always branch out and learn new skills and apply it to your practice. That's one of the many reasons I love dentistry. So I've had some great mentors in my life, both in dental school and in my time out of dental school, and I really wanted to share some of the tips that they gave me and some of the stuff that I've experienced with my patients. Today we're going to talk about 6 ways you can make your life easier when doing fillings. Now these tips can apply to almost every filling that you're doing, and they will make your lives a whole lot easier. A filling can be the most straightforward part of our day, but sometimes we can run into some complications. Whether the decay goes way deeper than we expected and we're nearing the pulp, or if restoring proper anatomy and contours is way harder than expected. Just a side note, these tips are all for composite resin. So the first tip I'd give for any filling you're doing, whether it's a class 2 or an occlusal, is your actual cavity prep. You want to make sure you get a good border first. Obviously you want to remove all the decay, right? But you want to do it the right way. So I know this sounds basic, but you really need good visual of the decay to remove it properly. The last thing you want to do is just go chasing caries, because you don't know where it ends and you're going to end up removing more tooth structure. So in any filling you're doing, it's really important to get a good cavity outline. Once you have a good outline and a clean DEJ, you can start removing the caries and know that you don't have to go any more laterally. And at this point, it's usually a good time to switch to your slow speed and use a round burr. The best success I've had with this is to use the largest round burr that fits. So whether it's a number 6 or a number 4, you want to start from the outside in and work your way towards the center of that decay. So this will actually do 2 things. It'll prevent you from pulping it, and it'll isolate the caries to the smallest possible spot. Now when you're nearing the pulp and you think you have all the decay out, I have 3 things that I love doing to make sure that I have all the decay out. The first is to actually mechanically feel it with your Explorer. If it feels soft and is flaky, it's probably still carious. If it feels hard with your Explorer and is scratching, you can also use a spoon excavator, because sometimes the Explorer doesn't really catch anything, but the spoon will really scoop out any remaining decay. And after you've done both of those, the third thing I do is use a caries detector dye. So you want to be careful with this stuff because it could stain your clothes or it could stain the patient's clothes. And I guarantee you they're not going to be happy if you stain their shirt. But this stuff will stain any remaining decay on the tooth, so you'll know exactly what to remove. Now if you are nearing the pulp, you want to consider doing an indirect pulp cap. But this is the part where you really have to differentiate between infected and affected dentin. The infected dentin is what you actually have to remove, but the affected dentin is what you can actually leave behind. Now what is the difference between these two? The infected dentin is the part of the dentin that is actually infiltrated with bacteria. So this is the part that's going to be soft and actually requires removal. But the affected dentin is a deeper layer of dentin, and this part has not been infiltrated by bacteria and we do not have to remove it. So this is also where that caries detector dye really comes into play, because the caries detector dye will stain infected dentin, but it will not stain affected dentin. So once you think you're finished with your cavity prep and you removed all the decay, you want to round out all your line angles, because if you keep a sharp 90-degree line angle, composite doesn't like that and it has a higher likelihood of fracturing in the future. Okay, so you have a good prep, now it's time for the fun stuff. Now it's time to etch and bond and actually start filling. So what was done for a long time was a total etch technique, which was where you etch the entire prep, including the enamel and the dentin, and you let it sit for 20 seconds or 15 seconds for the dentin, and then you remove it. But this actually led to some issues. First, it led to a lot of sensitivity. So the reason we etch dentin is to remove the smear layer. So what is the smear layer exactly? When you drill into a tooth, the top layer is now the smear layer, and that part is loosely attached to the tooth. So if you bond to this, it's not going to bond well and it could debond. So while this total etch technique removed the smear layer, it actually removes it so much that it exposes the dentinal tubules. And you may have heard of the hydrodynamic theory of pain, but basically what it's saying is that fluid movement in those dentinal tubules is what's causing pain. Also, this total etching doesn't bond as well because since the phosphoric acid is so strong, it actually damages the collagen network in the dentin. So now what people switch to, and what I like to do, is selectively etching your enamel with phosphoric acid and self-etching your dentin. So the way I do it is I etch the enamel, I let it sit for 20 seconds, and then I rinse it for at least 10 seconds. You don't want to just rinse and get rid of the acid right away, because just because that etch is gone, that pH of that environment could still be acidic. So when you're drying it, you want to make sure you do not over dry the area. You can either lightly dry with the air water syringe or even use a cotton pellet to dry. If you over dry this area, the collagen in the dentin collapses and you have nothing to bond to. But if you keep it slightly moist, that collagen does not collapse. Also, our bodies make enzymes that break down proteins. These enzymes are called MMPs and they're found in our dentin. One of the reasons you get debonding and reduced bond strength over time is these MMPs. Because when you use the phosphoric acid on the dentin, these MMPs get activated and they start degrading the collagen. So something else you can try after drying the tooth is to re-wet the tooth with an MMP inhibitor. An example of this is Gluma. What happens when you re-wet the tooth is that collagen network will be restored. Not only that, Gluma has a lot of other benefits. It blocks the dentinal tubules, which can prevent sensitivity by blocking that fluid from flowing, and it's antibacterial. So I know we talked a lot about etching. The next part is to use our adhesive. Because our adhesive has self-etching, it can penetrate through the smear layer and enhance bonding. But it's not so strong, so it won't remove the whole smear layer. So what happens is those dentinal tubules will still be blocked by the smear layer, but everything else will be exposed. So it's kind of a win-win. You prevent sensitivity and you increase bonding. After you apply the adhesive, you want to blow air until it's thin dry, because you don't want too thick of a layer between your composite and the tooth. So I hope I didn't bore you, because that stuff was really technical and really detailed. The third tip I want to give you is to make sure you have really good isolation. Especially when you're working with composite, you want to make sure that this stuff does not get contaminated with saliva or blood. So whether you're using a rubber dam, some cotton rolls with suction in the back of the mouth, you just want to avoid any contamination. It's the most annoying thing when blood or saliva gets into your prep after you started filling, because now you have to start from the beginning. Now when you have good isolation and you already etched and bonded, the first thing I like to do is get a flat pulpal floor with my first layer of composite. It's really important not to make this more than 2 millimeters. I know some people like to bulk fill, but you want to make sure that you can cure all the way through. After I get that flat pulpal floor, I just do oblique layers until the filling is complete, just making sure they're not more than 2 millimeters in depth. Another reason I like to keep the layers less than 2 millimeters is because it minimizes the polymerization shrinkage. We all know composite shrinks as it's cured, so if you keep the layers less than 2 millimeters, you'll have less sensitivity and less chance for the composite to deform. The next tip I have is when you're doing a class 2. After you have your sectional matrix on or your Tafelmayer on and you're ready to go, the first thing I like to do is to put flowable composite right in the floor of the box. This will make sure you get a good cervical seal, but not only that, it'll prevent fluid from getting under that sectional matrix and into your prep. This shouldn't happen anyway if you have a good wedge and a good cervical seal. I just like to make sure. The next thing I do is I put a layer of composite right into that box and I push it against the band. You're basically making the mesial or the distal wall, so then after you cure it, you're essentially filling a class 1 prep. Now when you're doing this and you're pushing against the band, you're probably going to have some excess composite and some flash. I really like to remove this before curing it, because getting it out with the drill is just more of a headache. So I like to do this with an Explorer. I don't know if you can see this that well, but basically after you push it against that band, just put the back of the Explorer against the tooth and just slide it over. And you want to do this on both the buccal and the lingual sides, and you should get a majority of the flash off and have minimal adjusting to do after. When you're working with composites, you kind of want to think of composite as all one substance. So after you pull that composite in any direction, you want to make sure you push it back and reseal that margin. Now the last tip I have is your curing light. Have you ever seen decay under a composite and you start removing it and then that composite is all mushy mixed with that decay and you're wondering what the heck is going on? That's because it wasn't cured properly. Now there's a few reasons that something like that could have happened, and it's hard to backtrack and figure out exactly what went wrong, but composite only fully cures depending on how much light it actually receives. And just shining a light on it in any direction is not going to complete the cure. You want to make sure you cure parallel to your restoration. So if you're doing an occlusal, and this is my occlusal here, or I can pull out this. If this is my occlusal, and I cure from the side, or my assistant is curing from here and you're not looking at the light because you're not supposed to look at the light, it's not going to fully cure on the inside. You want to make sure you cure from the top of the tooth if you're doing an occlusal. That's how you cure parallel. And this will make sure your composite gets the adequate light it needs to fully cure. What other tips do you guys have for working with composites? Let us know in the comments section below. Also, if you have any other topics you want me to cover, let me know in the comments section as well. Thank you guys for watching, and make sure you like the video and subscribe to our channel for more content.